Hello everyone, and welcome to my TED Talk. I'm very new to doing TED Talks. This one would be my first. I would like to discuss several things today connected to a burning question. This burning question is on addiction. I want to go over the effects of it along with its connection to several different topics. There's COVID-19, as well as sports, and a connection to how it impacts an area in Malaysia and China that I will be going over. I'll be using 10 sources that I gathered up to go over this topic. I am new to doing a TED Talk, but I would like to try to be as thorough as I can be and not leave anything out. And what I want to discuss. I have a personal connection to addiction myself, being someone who has his own addiction. It is not to drugs, but it is to food. I overeat to an unhealthy level. That is my personal connection to the concept of addiction. Though as far as drugs go, I am more of an outsider. I do not fully grasp the whole addiction to that substance. I have had family members that have had an addiction to alcohol. I have seen the weight that that carries on a family. That is my perspective on addiction. I have seen pieces of it towards different things, but I have only seen a glimpse of what I am going to be talking about today. I will be diving in further and really getting more of an understanding myself, as well as trying to provide a level of information to others. Illicit drug use contributes to many adult deaths. There is a stigma to how we view drug users. There's an us versus them mentality, where basically we see them as not individuals. Just because somebody has an addiction does not make them less of a person. Unspoken or implicit stigma can show throughout people's way of observing things and how they react, showing a level of discrimination without saying a word. There is a level of separation attached to it, putting these people in a spot where you separate them into their own category, instead of recognizing that they are people, just people who have a concerning addiction that consumes them. There needs to be a support system that helps these people, allowing them to deal with the weight of what they have, the problem they have. Addiction to drugs can lead to sudden deaths, and it is important for the people that have lost somebody to drug addiction that they get help that they need, as well as to be able to cope with the loss that they have faced. I would like to address the COVID-19 period when it was at an all-time high. Around January of 2020, there was an announcement of an international public health emergency. The first step is that COVID was the early infection phase, where the viral infection gets into your system. That's the first phase of the COVID-19. The second part is the pulmonary phase, which is how your immune system responds to having COVID. And third is the hypercoagulatory phase. I'm sorry, but it's tough to pronounce this word. But this leads to 4, hyperinflammatory or end organ damage phase that can occur on the onset of infection of COVID. For those that use opioids as part of the drug use, respiratory capacity is decreased, so if they got COVID, there would be less of a chance of survival. The damage to the immune system can lead to less of a chance of survival. There is a way that it can be treated. There's interferon therapy that, if done at the beginning of a COVID-19 infection, can be effective in the recovery of opium-addicted patients and reduce their chances of dying. An aspect that can lead to drug use is a layer of depression and looking to seek a way of helping yourself not feel as depressed through unorthodox means. I want to talk now about the issue in Malaysia. As you can see on the slide, here's the Malaysian flag. Now, in Malaysia, there's a prevalence among the women in general population. They carry a prominent level of depression. Some of these women have children, and there might be a level of stress that they are carrying from that. But it can also be a positive level of stress with taking care of those that they love. There's data collected from 6 states within Malaysia using a basic questionnaire. The questionnaire really went over several different topics like parental stress scale, resilience scale, and depression rating scale, giving insight into how Malaysian women deal with all the stress and depression which they can face. These questionnaire methods better give insight into how the person feels and why the person feels them. In China, there are female meth users. These women believe that the meth is not something that they are addicted to, but they already are in a state of dependence on the meth. Meth has been a source to try to remove stress or stay fit, deviate from pain, or help reduce the issues of a disease, even to deal with alcoholism. A good system to provide information on these issues with taking meth is an educational program that can be implemented. This implementation can help individuals who are addicted understand the addiction and try to revise how they do things. Addiction is a road that people should not have to face without understanding. Really just trying to take the time to grasp it. Try to better themselves. Taking the time to dive more into Chinese drug addiction. Since the 21st century in China, drug addiction has gone up. It increased from 680,000 in 2000 to 2.4 million in 2018. 25,000 women became drug addicts by 2015. These are concerning numbers. The fact that it has gone up at a considerable rate with drug addiction, there are people out there that really need guidance in getting away from drug addiction, which is why I would like to reiterate the usage of a stronger educational system and imparting wisdom on drug addiction and how to step away from that. With this kind of information, it will really assist in people's understanding of their addiction and how they approach their addiction from the viewpoint of an outsider providing insight and education. Statistically, 6 out of 10 adults have used drugs at least once. Those who use it consistently can fall into relapse. The rate of a relapse could be as high as 70%, but with effective treatment, it is possible to prevent the relapse from occurring. But there must be effective treatment options tailored to the person. Depending on how high the severity of the addiction is, it will lead to how intense the treatment is. There is a theory called the schema theory. This theory is about people who use alcohol or substances they are trying to use as a coping strategy to avoid or hide themselves from problems that they are around them and their surroundings. I can personally understand schema theory. There are situations where people do not really want to face them, so they would search for an option that would allow them to disillusion themselves from their reality. There are multiple ways that they could do this that are outside of drugs, like taking walks or traveling somewhere you do not usually go to. One strong way of doing it I can see it is unfortunately drugs, though over time the building of addiction does not help them in the long term. By pursuing something that they should not, they are only putting themselves in a worse state, but they are also making themselves sicker. Now I would like to take the time to go over the molecular aspects of opioid receptors within the drug addiction aspects and pain management in sports. Opioids can provide a euphoric state and can be used as a form of medicine for an issue. So there are opioid receptors are there for them, and one is named mu-More kappa core delta receptor. And these are different receptors, and there's also one called NOP susceptive opioid peptide. Opioids are mostly used to help an individual who is experiencing extreme pain. But overusage is something that can easily lead to addiction. By the overusage of opioids, there is something called opioid use disorder that occurs, and the person risks having an overdose. There are opioids that are available for clinical use. Morphine is one. Also hydromorphone, levorphanol, oxymorphone, methadone, meperidine, and oxycodone. Some of these drugs can mimic naturally occurring sensations. There is a neurobiological aspect to addiction. When there are persistent molecular and cellular changes that is within the green lights rewards in the pathway system There are now adaptations that allows drug addiction to drive long-term vulnerability and to allow relapse to drug use, even if the person has been away for several years. Within drug addiction, people try to use drugs as a shortcut to help get the cerebral reward system activated sooner. They do not want to wait to feel it naturally. There is an impulsive state of being where the achievements of quick actions leads to, without thinking about the consequences, getting that sensation of pleasure that they want. The addict has a level of compulsive drug consumption, is repetitive and excessive, and it is all for the avoidance of feeling anxiety. It is an automated behavior during withdrawal symptoms that you feel anxiety. It is all about the dopamine chase. A man named Ruth Bernstein looked into interactions with opioids and amines and how their receptors and glutathione are. He took a deeper dive into the information about the deeper internal aspects of opioids. He found that some peptides are used to bind opioid compounds. An individual with the last name of Berthazine talked about how the issue that played with opioids and the tissue regeneration. With drug use, scar healing does not happen as quickly compared to the natural process. Drug usage interrupts it. I find it to be important that you let the body heal itself. Like if you have a scar, you got to have the time for it to heal. If somebody is on a drug that just makes their body work differently, then that really does affect how they heal. With substance abuse as well as smoking, alcohol, and illicit drug use, 11.8 million people die each year, more than counting all the cancers that kill people within a year combined. There's also more drug-related crime, and that affects how the criminal justice system works. It can cost an estimated amount of $740 billion per year on the justice system. There is a larger cost to addiction. Psychotherapy has been used to try to assist individuals with an addiction, as well as pharmacological interventions that are used to prevent addiction as well. Now, I would like to talk about the usage of immunotherapies. Vaccines are being created to help those who are addicted to drugs. There are clinical trials taking place that help make immunotherapies work through a process of genetic engineering. Also using lab mice, they are used to help the process of creating immunotherapies. There's one called the anti-meth immunotherapy, with meth being very addictive. In use on putting this meth immunotherapy on a rat, the antibodies were created against meth. Looks like an anti-meth vaccine that is in development has gone through a lot of progress since 1973, when earlier immune testing was being done. To address a conclusion that I have gained from these 10 sources is that there needs to be more of an education that is taking place across the world in really discussing drug addiction. There's no use in sugarcoating things. There's a need to show what it really does to people. Many people face addiction across the world, and that's not good health-wise. There needs to be more of a development within immunotherapies. More money funding that type of thing to get people off of drugs, or at least ease them away from using drugs. I know that there are people that are chasing the dopamine rush and they can get from the drug usage, but it is best to have the dopamine rush come from natural sources of the body, not from a forced source like opioids. To conclude, I'm going to show the 10 sources that I used in this slide here. It's a way of referencing them before I close out. I want to thank you all for watching my presentation. I hope you all learned a little bit from it.